I consider this a jewel in the middle of nowhere. Once you come here, you discover that it's not a myth, it's actually true. From medical to dental to behavioral health, you can get quality care right here in your own neighborhood.
It's not only about one patient, but it's really about creating that community and then creating a healthier generation for the future.
You're taking care of a different set of population. You feel like you're really giving back and helping out people who really need it.
I'm learning from them, and they're learning from me. And really, it's about engaging and connecting.
Each individual is different income, different way of living, so we go the extra mile to help them.
It's close, convenient. Instead of having to go all the way to Bentop or to the medical center, I'm not just an employee, I'm also a patient.
I love it here. I'm a patient here. My parents are here. I love the doctors. I love the camaraderie with the employees. It's home for me.
Definitely, there should be more clinics like this.
For the majority of Houstonians, they probably would be surprised to know that in our city, there are communities where people don't have access to a doctor. You think about the medical center where people come from all over the world to seek medical care, and yet we have neighborhoods where literally people do not have doctors. There are private practices that won't go into those communities because they're not going to make money. That's the beauty of Vecino, because we locate in the neighborhood. And you can see from our Denver Harbor Clinic, we're surrounded by homes right there where the people who need us can access us. So that's the first step in really connecting the people to the services that they need.
Yes.
Hi. How are you, Ms. Gonzalez? I'm Dr. Slade, is one of my medical students.
Nice to meet you.
So you're a new patient. You go to an ER or urgent care, the philosophy is different. It's to patch you up. It's to make sure nothing horrible is going on. And then if there is, take care of that one thing, stabilize, and send you back, but hopefully back to us. Well, if we can catch a lot of these people, hopefully we can reduce the emergency visits, the urgent care visits, and hopefully try to take care of those things before it starts.
A lot of the people that we see are people that have undergone enormous stressors. Poverty is certainly a humongous stressor, and that shows up in many different forms. There's going to be more depression. Perhaps there are going to be more drinking problems or other substances. All of that affects the whole family. So the fact that we have integrated services here allows us to address the family.
We talk about diabetes. We talk about prevention of smoking. We talk about hypertension. But besides that, because we know what are the needs of our community, we do help people to enroll to different services, not only here in our clinic, but also that are available to them, through the city, through the county.
I think that the way you quantify winning kind of changes over time. Initially it's day to day. Now it's maybe year to year. We know how we're going to fund ourselves for the next year. And so the next question is, how can we build the organization? How can we expand and provide more care? Because there's so much demand and there's so much need.
It really speaks to our leadership that we do have that commitment, that we are a team. Everybody has the chance to speak, and ultimately, do we buy in? Are we all on the same page?
Along with being a good neighborhood health center, which has been our core business for 14 years now, I think having the relationship with the residency program allows us to expand that mission. We train people here who learn to work in neighborhood clinics, and then when they leave here, they keep that mindset with them. And I think we've got a good track record of graduates of our program for at least part of their career giving back, of working in other neighborhood clinics, of working in rural areas or with the underserved. So I think it really does multiply our mission.
We have to take into account of finances and what kind of medicines they can afford. There's no point in prescribing something if they can't buy it. So we all practice in underserved communities in med school. So I think we're well equipped to go out into communities and help because of that experience.
One thing this organization, I think, has a good history of is showing that we're not just jumping for dollars. We're trying to raise money to grow, to expand in a very careful and well-planned manner.
It's not only building the building, but it's also building the human resource infrastructure, our systems, and be able to provide the same quality of care that we're providing right now. We don't want to grow and then decreasing the quality of care that we provide to our patients.
I think we've kind of hit the next part of the game, maybe another quarter of the game, which is growth. How are we going to grow? and what's the best way to grow? How can we build the organization? How can we expand and provide more care, because there's so much demand and there's so much need.
Before, the patients didn't have anywhere to go, so I think it's been wonderful that they've been able to come here, get excellent care, even if they didn't have the money.
I think it's been a good experience. We're learning more about our patients, a better understanding of what their requirements, their expectations will be in the future.
I guess gratifying that you can take care of a whole patient population from newborns all the way up to geriatrics, and I think that's pretty unique with family medicine, that you can kind of address everything.
I always tell my staff, act like that patient that walks in the door is a family member, not necessarily somebody just off the street. Close your eyes and open them back up, and that's somebody you know standing there. And then you take care of them totally different.
Really, we work on healing the family, if you will, the nucleus of the family, to create a better community and a community that has more opportunity for the future. So really, we work on building the future.